Hi, I'm Dr. Sridhar Ganapathy, a practicing pediatrician from Mumbai. Welcome to the Steer channel, an educational initiative by my teacher, Dr. Y.K. Amdekar. The topic for the day, skin manifestations in systemic disorder. Let's start off with looking at the obvious and then the ones where a little bit of common sense is required, and then the unexpected ones, and then we shall proceed looking at the individual components of the skin. So the obvious. Two conditions that come to my mind is from the rheumatological disorder, wherein you have photosensitivity, that is systemic lupus erythematosus and dermatomyositis, wherein you have a rash on the face, the centrofacial rash. May also be called as a butterfly rash with the nasolabial sparing in SLE, whereas there is no sparing in dermatomyositis. And there is the heliotrope sign, wherein you have that violaceous hue to the upper eyelids. And all these manifestations are on the sun-exposed areas of the face. Immune-mediated collagen vascular disease, they may be the initial manifestation, and you need to look beyond. But there is a word of caution. Dermatomyositis can also be a paraneoplastic phenomena. That is, it could be secondary to an internal malignancy, right from a breast cancer to an ovarian to a cervical, or an internal malignancy could start off with a dermatomyositis and would disappear the moment the malignancy is controlled. The second is the common sense category. You have an individual with recurrent balanoposthitis, which is candidial, or recurrent intertrigo, which is candidial. You need to work this patient up for diabetes mellitus. You have a child with persistent seborrhoeic dermatitis, recalcitrant, not a good response to therapy. You need to look for immunodeficiencies, including HIV. And the third category, the unexpected. Seborrhoeic keratitis, usually benign, but you suddenly have a crop of seborrhoeic keratitis, which looks like candle droppings, black, brown in color, and the numbers have increased. It could be suggestive of an internal malignancy. You have an acanthosis nigricans in a thin individual, extensive, suddenly cropping up, even the lips are involved. This could again suggest an internal malignancy. Palmoplantar hyperkeratosis, hypertrichosis lanuginosa, again could be indicative of a malignancy. Sudden onset ichthyosis has been linked to Hodgkin's disease. I already discussed dermatomyositis as a paraneoplastic phenomenon. So there are a lot of things that could crop up and could give you a clue as to you need to rule out an internal malignancy. So we finished off the common sense, the obvious, and the unexpected. Now let's dissect out the skin to the individual structures. And since fat is making all the headlines, we'll start with the subcutaneous fat. An absence of the subcutaneous fat. Lipodystrophy. Generalized lipodystrophy, insulin resistance is very well known. Paniculitis, erythema nodosum. So here you have a child with dysentery, getting blood and mucus in stools, frequent episodes with perianal lesions, and now develops the erythema nodosum. You know this could be an inflammatory bowel disease, likely to be Crohn's disease. You have a child with lymph nodes on the X-ray chest, potato lymph nodes, and you have respiratory problems. You have a Mantoux which is negative, and this child has erythema nodosum, and you know this could be sarcoid or tuberculosis. But you need to look further because EN is associated with even drug intake like sulfonamides, a simple streptococcal sore throat, leprosy, and there are many more which could give rise to erythema nodosum, which is paniculitis, inflammation of fat cells in the subcutaneous plane. You can also have a sclerosing paniculitis, which is seen in chronic venous insufficiency, again over the shin, lower limbs, inverted wine bottle appearance. So we discussed lipodystrophy, we discussed paniculitis. The third category is the oozing out of fat into the subcutaneous plane in lumps. So you could have a xanthoma, you could have a xanthilesma, and they could indicate dyslipidemias, they could indicate a liver disorder like primary biliary cirrhosis. So you need to understand that these could be clues to something more dangerous going on inside. After the fat, let's come down to the skin color. You have a red hue to the skin, an erythematous stone, high fever, blanches on pressure. Could it be dengue? You have an erythematous stone, it's like erythroderma. 70% of the skin is involved, eczematis. You need to think of immunodeficiency syndromes when it is there right from birth. You have a red hue with alopecia. It could be an associated ichthyotic disorder, hair shaft abnormalities, it could be nethertons. You could have an eczematous skin with convulsions. You could think of biotinidase deficiency, wherein also you get alopecia. You could have an yellowish tinge to your skin, more prominent on the palms and soles. The eye looks absolutely clear. Carotenemia. This could be associated with hypothyroidism, nephrotic syndrome, and the list is long. Then let's come down to the basic pigment distribution. Hyperpigmentation, diffuse. The first thing that comes into my mind is adrenal insufficiency, Addisonian crisis, ACTH excess, MSH in excess, or MSH-like properties could also be usually seen when you have an adrenal insufficiency, photoexposed areas of the body, frictional areas, oral cavity, palmoplantar creases. Even hyperthyroidism can give rise to hyperpigmentation on the exposed parts of the bodies. Then you could have diffuse depigmentation right from birth, albinism. So the oculocutaneous albinism and the syndromic albinisms, which could have a funny silver type of hair, which could have a bleeding tendency like the Hermansky-Pundlak where there is a platelet functional defect. You could have immunological and neurological defects with the Griscelli and the Shediac-Higashi syndrome. So you need to understand that diffuse hypopigmentation, you need to keep these things in mind. Patchy hypopigmentation, vitiligo. I'm talking about depigmentation. Vitiligo, an autoimmune condition, so other autoimmune conditions could coexist. You could have a thyroid affection like Hashimoto's. You could have diabetes mellitus. You could have pernicious anemia. So all these three could be a manifestation of an umbrella autoimmune disorder. Then you could have hypopigmented spots with epilepsy. It could be adenoma sebaceum or angiofibromas with epilepsy. And all these will fit into tuberous sclerosis, a condition, neurocutaneous syndromes, where also you can have cafe au lait spots. These are pigmented macules based on the numbers and the position, like an axillary freckling. An inguinal freckling has more significance, otherwise the numbers and the size take over. Or a segmental cafe au lait spot with precocious puberty, and these could be associated with CNS aberrations. They could be associated with fibrous dysplasia of the bone. So tuberous sclerosis, hypopigmented spots, ash leaf appearance, shagreen patches, fibromas, they're basically angiofibromas, cafe au lait spots on which could be localized just to the trunk, or you could have axillary and inguinal freckling. You could have segmental cafe au lait spots, the big ones, with associated abnormalities under the neurocutaneous umbrella. Following pigmentation, you go to the vessels. The two vasculitic disorders that needs to be mentioned is one, Hinoch-Schönlein purpura and Kawasaki. Hinoch-Schönlein comes with palpable purpura, lower extremities, around the ankles, but could even be in the buttocks, with abdominal pain, with arthralgia, could have a renal involvement in a significant number of individuals. Kawasaki, which could come just with a morbilliform rash, high fever, paradoxical crying. These babies cry when you pick them up, with oral changes, a strawberry tongue, a cracked lips, a conjunctivitis which is non-exudative with perilimbic sparing, and in the first week, by the end, you get perianal desquamation as well as nail changes. You need to intervene fast to so-called to salvage the coronary vessels. The periangual desquamation, which is discussed so much in detail, is a very late sign, and also a reactivation of the BCG could give you a clue. So that is a little bit about vasculature. Hemorrhages, you could have bruising in the first year of life that could indicate late hemorrhagic disease of the newborn. You could have hemorrhages in the flanks and in the periumbilical area or in the upper aspect of the thigh, called as the Cullen sign, the Gray Turner, or the Fox's sign, in a sick child, which could indicate hemorrhagic pancreatitis, or it could be a retroperitoneal bleed. Then we come to the Pilo-sebaceous unit. So when you come to the Pilo-sebaceous unit, this has under a terrific hormonal influence. So when you have androgenetic type of alopecia, when you have seborrhea, when you have acne vulgaris, you have hirsutism, you know that is androgen excess. In a girl in the pubertal age, you think of PCOS. In an individual, later on, it could be a late onset of congenital adrenal hyperplasia or an androgen excess, any cause causing an androgen excess. Hair shaft abnormalities can denote a number of inborn errors like arginosuccinic aciduria. I also spoke about Netherton syndrome. Then when you go to the nails, you have so many types of nails. You could have the half nails, half opaque, half which are translucent, which could be hypoalbuminemic states. You could have half opaque and the terminal portion being pink, the Terry's nails, which could indicate a liver disorder. You could have the me lines alternating white and normal lines, could be seen in arsenic and thallium poisoning. You could have the yellow nails, which could be associated with lymphedema and respiratory problems. You could have the nail patella syndrome with renal as well as eye involvement, and they need to be assessed. So we have discussed the nails, we have discussed the hair, we have discussed the Pilo-sebaceous unit. Then comes the sweat glands. Sweating could be abnormal in hyperthyroidism, excessive sweating. So also where the autonomic nervous system is affected, like in diabetes mellitus. So any rash on the skin should not be neglected. You need to look beyond the rash, and it could be pointing out to something more sinister sitting inside. Thank you.